I'm Michelle McCallum, Press Secretary, and we're so glad that you are here with us today for this very important discussion. We will be discussing COVID trends and vaccine guidance for children 6 months and up. We have with us today our State Health Officer, Dr. Joseph Kanter, and the President of the Louisiana chapter of the American Academy of Pediatrics, Dr. Rachel Chatters. Welcome. After they present the information, we'll have a Q&A, and we're asking that only members of the working press participate in the Q&A. You can put your name and outlet in the chat, and our team member, Kevin Litton, will call upon you to ask your question. So again, thank you for being with us today, and I'll turn it over to Dr. Kanter.
Michelle, thanks so much, and good afternoon, everyone. It's really nice to see some names that I haven't had a chance to talk to in a while. I hope everyone had a nice Father's Day and a meaningful Juneteenth celebration. I am very pleased to be joined by Dr. Rachel Chatters. She's a practicing pediatrician in Lake Charles and the current president of the Louisiana chapter of the American Association of Pediatricians, of Pediatrics. What we're going to do today, I have a few slides to share. I'll review the news of expanded eligibility for COVID vaccines. I'll talk a little bit about the data behind the decision and why this is significant for families of Louisiana. I'll mention where families can access vaccine for the youngest children. I'll have Dr. Chatters say a few words from her perspective, and then we'll be happy to answer any questions that might be out there. I recognize it's been a minute since we've had the opportunity to speak with the press in this forum about COVID in general. So happy to answer any questions that might be out there. I'm going to share my screen right now, and then there we go. Kevin already did it. Great. And we will go ahead and Kevin, if you don't mind, it might be easier if I just share the screen on my end, because the display is a little bit weird on my end. So if you don't mind stopping, I'll just share it on my end if that's okay. Okay. Okay, great. We'll go ahead and get going right now. Before I talk about the vaccine, I want to just take a minute and catch people up on where we are with the pandemic in general right now. We have had 5 surges to date in Louisiana. Currently, we are in our 6th increase or surge, but it's significantly different from the ones that we've had before. And I'll tell you what I mean by that in a second. But there is no doubt right now that there is a lot of COVID being transmitted, being spread in Louisiana. If you look at the amount of COVID coming into emergency departments, we've gone up from 4.4 to 4.7% of ER visits are attributable to people seeking care for symptoms suggestive of COVID. That's the graph on the top left. On the top right, you see COVID cases, the number of positive tests being reported to us in the Department of Health every day. And you note that the increase right now is significantly smaller than the prior surge that we had, the one in January and February. A main reason for that is many more tests are being conducted at home rapid tests right now, and those don't get formally reported to us in the state. But we still know that we are surging or having an increase in cases right now. And one of the idioms that we like to say is you don't need to count every raindrop to know it's raining pretty heavily. And there's a lot of COVID being spread right now. On the bottom left-hand side, you'll see a combination graph. The purple line is testing volume, or how many formal tests, those being reported to the state, are being conducted and reported every day. And as you see, we have less and less tests being conducted formally or reported to us. That doesn't mean no people are getting tested. They're just happening at home in rapid tests. The percent positivity of all tests out there has gone up this past week from 13.3% to 13.6%. The most important graph on here is the bottom right, and that's the number of people hospitalized today with COVID-19. And thankfully, as compared to prior surges, on average, people are not getting very sick with this variety of COVID that's being spread right now. That's not to say 100% of people don't get sick. We still do have people hospitalized. And today, 350 people are hospitalized with COVID in Louisiana, of which 11 are on mechanical ventilators. But that percentage, 3% of the hospitalized patients on vents, is much, much less than it has been in prior surges. In our Omicron surge a few months ago, that was around 10%. And in our Delta surge a few months prior to that, about 20% of hospitalized patients were sick enough to be put on ventilators. Of the 350 patients COVID positive and hospitalized throughout the state today, 63% of them are not fully vaccinated, and 87% of them are not vaccinated plus boosted. What we are experiencing right now, thankfully, is a decoupling of cases from hospitalizations and deaths. And what I mean by that is, in prior surges, this amount of COVID transmission, this amount of COVID out there would translate into a much larger degree of hospitalizations and deaths. We are thankfully not seeing that this time around. On the left, you see COVID deaths categorized by date of the death. You can clearly see the 5 surges we've had to date. And currently in our 6th surge right now, we're seeing very little increase in deaths. Now, granted, this is a relatively lagging measure, which means that we oftentimes have to wait a couple of weeks to see the deaths get reported. But still, with the amount of hospitalizations that we have currently, on the right-hand side, you can see total COVID hospitalizations. We have a very small blip right now compared to what the big surges have been in prior months of COVID. And just to put it in comparison, in our Delta surge, this was the fall of 2021, we had over 3,000 people hospitalized with COVID at one point in time at the peak, of which about 500 were on ventilators. In the Omicron surge, that's the surge that was in July and February of this current year, we had over 2,000 people hospitalized at the peak, of which 180 were on ventilators. And right now, we only have 350 people hospitalized, of which 11 are on ventilators. So a much lower acuity of this current surge. A lot of people being infected with COVID, not a lot of people getting very sick or hospitalized or dying. And that's relatively good news. We cannot overstate, I think, the impact of COVID on children. And I think we need to spend a minute and just review what the toll has been on children in Louisiana. Children under 5 are at a higher risk for hospitalization from COVID-19 than our older children. And that's true for a number of other infectious diseases as well. Half of the hospitalizations in kids due to COVID that we have had in this state have been in children younger than the age of 5. Half of all 0 to 18 hospitalizations for COVID have been in kids younger than age 5. And of the 21 children that have died from COVID in Louisiana, 9 of these were younger than 5, and none of those 21 children had the benefit of being fully vaccinated. We have had over 300 cases of the severe syndrome, multisystem inflammatory syndrome in children. And of those 334 cases in Louisiana, over 100 were in kids below 5. So the toll is certainly not insignificant on kids of this age group. This graph is national data, and it illustrates the toll on hospitalizations for all kids broken up by age. The gold line is hospitalizations in kids between the ages of 0 and 4. And the gray line is kids hospitalized for COVID between the ages of 5 and 17. And you can see a significantly higher percentage of hospitalizations are due to kids in that younger age group. These kids do get sicker on average than older kids do when it comes to COVID-19. Even though on average, kids tend to do well with COVID. That's far from 100%, and the younger kids tend to do worse than the older kids do. Looking at the same data, a little bit more granular, we have 3 categories here: kids aged 6 months through 4 years, that's the red line; kids aged 5 to 11 years, that's the light blue line; and children aged 12 to 17, that's the dark blue line. This is looking at national COVID-19 hospitalizations from the beginning of the pandemic up until March of this year. You can clearly see that in this younger age group, the 6 months through 4 years, we have notably more hospitalizations than the older age group kids represent. The same data holds true for visits to the emergency department for COVID-19. The green line here is ER visits for COVID-19 in kids 0 through 4. The blue line is in kids 5 to 11 years of age, and the yellow line is in kids 12 to 15. And you can see that for the past year, or really throughout the bulk of the pandemic, children aged 0 through 5 have represented the largest share of pediatric emergency department visits for COVID-19. Unfortunately, COVID-19 is a leading cause of death amongst children nationwide. This is national data that was presented by the CDC just a few days ago. From the beginning of the pandemic until the end of April this year, COVID-19 is the 5th leading cause of death in kids aged 1 through 9, and the 4th leading cause of death in kids between the ages of 10 and 18. It's a misnomer that COVID is not a significant concern for kids. Again, while most kids do okay with COVID, that's not all kids. And with the amount of COVID that has been spread and is currently spreading, it's far from insignificant. Again, 5th and 4th leading cause of death in these pediatric age groups, COVID-19. There is a misconception that kids are being admitted with COVID as opposed to for COVID. This is groups of data that looked real specifically at why kids are in the hospital who are COVID positive. And during the Omicron period from the middle of December 2021 through the end of March 2022, 86% of kids aged 6 months through 4 years who were admitted to the hospital and COVID positive were there because of COVID. COVID was the primary admitting diagnosis. And prior to the Omicron surge, from the beginning of the pandemic until December 21, that number was 87%. These are the populations of children that were admitted to the hospital specifically because of COVID, not just found to be COVID positive incidentally. Another misconception is that only kids who are sick at baseline or have a lot of underlying conditions are affected by COVID-19. This is national data looking at 2 different sources of data at what underlying conditions kids have who are admitted to the hospital for COVID-19. And for kids aged 6 months through 4 years, over 50% of the children that admitted because of COVID-19 had no underlying medical conditions at all. 0 underlying medical conditions. Of the ones that do, a lot of these are very common conditions like asthma and diabetes, things that are relatively common, particularly amongst children in Louisiana. But over 50% of the kids in this age group admitted to the hospital nationally with COVID-19 had absolutely no underlying conditions. Families also have a big stake in this, aside from the health of their children, and having a child vaccinated, protected from COVID-19 benefits the family in other ways as well. What you're looking at here is national data on the percent of parents who say that in the past year, they or another adult in their household had to leave a job or change their work schedule to take care of their children. 39% of all parents said they had to do that, but that number was highest, 48%, in parents of kids under the age of 5. These kids represent an outsized burden on their parents when they do become sick with COVID-19. There's an important equity angle to this as well, and I want to take a second to mention this. The highest percentage of parents who said they had to leave or change their job times because of their kids getting COVID-19 were in Black parents. Nationally, 53% of Black parents. And by far, the lower on the income scale a parent was, the higher the likelihood was they had to make employment modifications. 51% on the bottom right of households with incomes less than $40,000 a year, 51% of those families had to make significant employment modifications because of children and COVID-19. All this to say the benefits of getting young kids vaccinated against COVID-19 are profound for families, and particularly profound for the most marginalized families out there. Of course, the most important thing here above all else is saving lives. And at the end of the day, that is the prime advantage of vaccinating children against COVID-19. Looking at ages above 5, which up until today are the ones that were eligible to get vaccinated, through April 4th of 2021 until April of this year, unvaccinated people above the age of 5 had a 10 times risk of dying from COVID-19 than people who were vaccinated with the 2-dose primary series. The black line there is fatality rate for people who were unvaccinated, and the blue line is fatality rate for people who are vaccinated. We are very pleased to be able to extend the opportunity for this type of protection to younger kids as well, below the age of 5. There is also a misnomer that COVID-19 and the COVID-19 vaccine is substantively different from other childhood vaccines. And I wanted to illustrate how untrue that sentiment is real quickly. When you look at the burden that other vaccine preventable illnesses had on kids and what led to the development of those vaccines, COVID-19 actually represents a much higher burden than some of the other viruses that we vaccinate against. Let me illustrate that. The hepatitis A vaccine became available in the mid to late 90s. Prior to that, between 1990 and 1995, for everyone below the ages of 20, in the US, there were 3 deaths per year due to hepatitis A. For meningitis, due to meningococcal virus or bacteria, between the ages of 11 to 18, in the years of 2000 to 2004, there were 8 deaths on average per year in the US. For varicella or chickenpox, there were 16 deaths per year between the ages of 5 to 19 prior to the vaccine becoming available. For rubella, prior to that vaccine coming available, 17 deaths per year on average. For rotavirus, prior to that vaccine becoming available, 20 deaths per year in kids younger than 5 nationally. For COVID-19, in kids 6 months through 4 years, the population we're really talking about right now, there have been on average 86 deaths annually in the US, far greater than the other vaccines that we routinely vaccinate for. If you want to look at the burden that a particular disease has on kids and what justifies the efforts behind vaccination, COVID is literally in a league all of its own. This vaccine is important. This vaccine will save lives, as have all of these other vaccines. So what exactly did the FDA and the CDC do this past week? On June 16th, last week, the FDA extended emergency use authorization for the Moderna vaccine in kids aged 6 months through 5 years. This is a 2-dose vaccine from Moderna with an optional 3rd dose for children who are immunocompromised. The FDA also extended emergency use authorization to the Pfizer vaccine in ages 6 months through 4 years. And the Pfizer vaccine is a 3-dose series in kids at this age. The FDA also extended emergency use authorization for the Moderna vaccine in older kids, kids ages 6 through 17. And you'll remember that up until this happened late last week, only the Pfizer vaccine was eligible for kids below the age of 18. Now, above the age of 6 months, families have the opportunity to vaccinate from either Pfizer or Moderna. Both have emergency use authorizations. This FDA decision or decisions was based on the recommendation of their independent advisory committee, the Vaccine and Related Biological Products Advisory Committee, or VRBPAC. That met last week, issued their recommendation to the FDA commissioner, who issued these extensions of the emergency use authorizations. After that, the CDC's independent advisory group, the ACIP group, or the advisory group on immunization practices for children, met, issued a unanimous recommendation to the CDC to recommend the COVID vaccine in everyone 6 months of age and up. And the CDC director, Dr. Walensky, accepted those recommendations over the weekend. It is now the clear unambiguous recommendation of both CDC and LDH that everyone ages 6 months and up get vaccinated against COVID-19. A couple of differences in the two vaccines available for this age group. The Moderna vaccine, again, goes through 6 months through 5 years. It's given as 2 separate doses, 4 weeks apart. The Pfizer vaccine is given as 3 doses, the second one being 3 weeks after the first, and then the third being at least 2 months after the second. Both of these vaccines are completely acceptable. We make no specific recommendation of one of these over the other. Some families will want a 2-dose series and go with the Moderna vaccine. Some families will want the 3-dose series, which is a little bit smaller of a dose in each of those 3 doses, and go with the Pfizer vaccine. We make no specific recommendation between these 2 vaccine options. So what do we know about this age group in Louisiana? There are about 281,000 children between the ages of 6 months and 5 years in Louisiana. Of those 281,000 children, about 33% are Black, 63% are white, and almost 2% are Asian. Amongst all children under 5 nationwide, over 40% are covered by Medicaid. And in Louisiana, there are just shy of 200,000 Medicaid enrollees in this age group. We're working closely with our Medicaid providers to make sure that these families know about the vaccine and have options to go and get the children vaccinated. We know that Hispanic parents, Black parents, and parents with lower incomes were more likely to say that they might have to miss work to get their child vaccinated, and that they won't have a trusted place to go. We're making sure that there are options and availability for people to get their families vaccinated across Louisiana. So what to do if you're a family, where to go? The first place to go to for a vaccine in these younger kids is going to be a child's pediatrician office. That's where the bulk of childhood vaccines are given. That's where families feel most comfortable. We've had pediatric clinics throughout the state pre-ordering vaccine from us over the past couple of weeks, and those vaccine shipments are being delivered right now and will continue to be delivered over this week. So the first place a family should go is their pediatric office. Families should know that pediatricians might not have received their COVID-19 vaccine supply today. It might come tomorrow or the next day over the course of this week. But the first place a family should go to get their kids vaccinated against COVID is their pediatrician. If their pediatrician is unable or doesn't have the vaccine, then they can go online at ldh.gov/kidsvax or to the federal site vaccines.gov to find a vaccine provider in their area that does have the vaccine. They can also call our COVID-19 support hotline. This is open 7 days a week at 855-453-0774. We can direct them to a vaccine provider close to them. All of this information is online as well. I'm going to pause there. I'm going to turn it over to Dr. Chatters to speak a little bit more from her perspective as a pediatrician and as the president of the Louisiana chapter of the Academy of Pediatrics. Dr. Chatters.
Yes, thank you. And thanks for inviting me to represent our chapter of the Louisiana chapter of Academy of Pediatrics, and just in general, pediatricians in our state and providers of pediatric healthcare. I just want to make it very, very clear that we are in support of the COVID vaccine as our best hope. It's our greatest tool for ending this current pandemic. And I know there are lots of comments relative to what ending means, but to getting to where this is not the leading cause of death among children, leading cause of morbidity and mortality in our state and in our country and in the world for that matter. Being vaccinated is life-saving. This was true when we started the initial rollout for our geriatric populations. This was true for first responder populations. This was the truth for our over 18 population. As we rolled out these vaccines, this was true for our 12 and older, our 5 to 12-year-old, and it is most certainly true for our 6-month and older population at this point. And delaying immunizations against COVID-19 leaves children vulnerable to infection for a longer period of time and it places them at greater risk for serious illness and death. So our best way to prevent severe morbidity and mortality in the midst of multiple variants of COVID is to be immunized. And so I just really want to just take one moment and just make the comment regarding unfounded claims. It's been mentioned earlier in our talk, but these claims on social media, among family even, among friends and other members of our communities have been mostly what they are, unfounded claims. They have for example, the unfounded claim of linking infertility or puberty issues or concerns with COVID vaccine presentations have been scientifically disproven. This has been among trial participants, among the millions of vaccine recipients, and not to mention even among the animal studies regarding these vaccines. So all of those claims regarding that are unfounded. And this has been a major contention point in pediatrics. Many people say, oh, I will get vaccinated, but I'm making that decision for myself and I wouldn't decide it for my children. Well, we are the deciders. We are the gatekeepers of our children's health care. We have to make those sort of decisions. Our children cannot make those decisions for themselves. We have to make those decisions, and we have to make them based on the health and well-being of our children and not whether or not they're getting 1, 2, or 3 vaccines that day. And which brings me to another point that I just want to emphasize, that the Academy of Pediatrics, the National Academy and the Louisiana chapter supports co-administration of COVID-19 vaccine with other vaccines on the immunization schedule for your children. We would like to emphasize that we have to catch up on our immunization schedules and include COVID-19 in our immunization schedule. Pediatricians across the state are prepared for this. We are excited and encouraging this immunization process. And we would like to thank everyone for their extraordinary service and dedication to protecting the health of our children during this global crisis. So please talk with your pediatrician, ask questions. We encourage that. We want you to ask questions and make a plan for your child, your children, as we go forth in their good health and immunized status. Thank you.
Thank you so much, Dr. Chatters. Really appreciate that. We wanted to open it up to questions from reporters now. Dr. Chatters, you're able to stay on to take a few if anybody has any, and we can start with Sabrina from Fox 8. You'll just have to unmute yourself since we have everybody kind of auto-muted.
All right, good afternoon. Thanks for taking questions. So why do you think younger kids are getting sicker when they get COVID? And my second question is, are you satisfied with the percentage of kids 5 and up who've gotten vaccinated in Louisiana?
Hey, thanks, Sabrina. I'll take a stab, and then I'll ask Dr. Chatters to comment on the first part of that as well. It's nice to see you, Sabrina. I'm not satisfied with the vaccination rates in general. So right now, only 17% of kids 5 to 11 have had their first dose. Only 47% of kids 12 to 17 have had their first doses. I think that's too low. I think that leaves families and kids vulnerable. I'm anxious to see those numbers go up as well, is the bottom line. I mean, I think any death from COVID when it is potentially prevented is a tragedy. And I'm anxious to see more families, even outside of this age range, take advantage of vaccines. There's no question about that. To the first part of your question, younger kids typically have a smaller margin of error in the simplest terms of when they get sick, and illnesses can progress quicker, and younger kids, particularly less than a year, can go from quite healthy to quite ill very rapidly. And that's one of the reasons why we see increased rates of significant complications of COVID in that age group. It's similar to influenza, where the younger kids are at more risk as well. Dr. Chatters, anything you would add to the specific risk to the very young kids with COVID?
I would like to mention that their reserve is less, so they have less of a tolerance. They're often their immune system is new, if you will. So we haven't had a lot of exposure, and it has not matured to the level that it can accommodate multiple things. Because generally, as we've mentioned, people are admitted for a problem with COVID sometimes, and not because of COVID all the time. And so our children everything is in process of growth. And so they, require a lot more to make it through any crisis at all.
I'll add, we do know that when a pregnant woman gets vaccinated against COVID, those antibodies are conferred to the fetus and to the child, and the young child benefits from those antibodies for the first few months of life, but they typically wear off by the time the kid hits 6 months of age. So being able to get that kid vaccinated at 6 months is a big benefit.
Great, thanks to you both. And just a reminder for everybody, if you just want to put your organization in the chat, you don't have to put your question. I just can't see everybody's organization in the list. We'll go next to Eli with WDSU.
I'm Eli Brown with WDSU in New Orleans. We just had a quick question about next school year. Is there any kind of work going into maybe recommending or requiring kids to have it by the time it starts, now that all kids that are school-aged are eligible?
Hey, Eli, great question. There will not be a requirement for the vaccine here. The kids at this age are not going to be required to be vaccinated. There was certainly discussion of that, but that's not going to happen. There's a school immunization schedule, required schedule that's set by LDH. And then a couple schools here and there have made their own schedules a little bit more aggressive than that. The COVID-19 vaccine will not be on the state schedule. For those few schools that do have it on their individual schedule, the exemptions afforded by state law still apply, which are religious, medical, and personal. So for those few schools that do have it, even though it's not on the state schedule, any family can opt out just by saying they want to opt out.
Great, thanks, Eli. Emily from the Advocate, time speaking in.
Yeah, hey there. So I'm wondering if you can tell me how many doses were pre-ordered in Louisiana, and then I noticed Walgreens is the big chain pharmacy, and I'm wondering if they will take kids as young as 6 months, because I know that can be a little tricky.
Yeah, hey Emily. In the ballpark of 20,000 pre-orders, but that's an estimate, and we can get you an exact number after this press conference. The orders are going to be rolling on this. Fortunately or unfortunately, depending on how you look at it, we do not anticipate vaccine supply to be a limiting factor in this age. We anticipate having more than enough vaccine for every family that wants. So as opposed to earlier on in the vaccine campaign, where orders were week by week and had to be triaged on some level, there's going to be rolling orders for this. Essentially, any provider that wants to order it, we anticipate there being enough available that it won't be a problem. The pre-orders were done really just to get the ball rolling so that providers would have vaccine available this week for families that want to get it as soon as possible. And as of the end of last week, there were 175 providers in the state that had pre-ordered, meaning they had it on hand, at the starting gun, but there'll be many more that order as the weeks go on. And to the pharmacy issue, it's a little bit nuanced and more complex than it was for older age groups. In older age groups, pharmacies were a real access point for vaccinations. And part of that was that the Federal PrEP Act extended allowance for pharmacists to vaccinate down to age 3, but it doesn't allow pharmacists to vaccinate below the age of 3 for COVID-19. For that and for other reasons, namely it's where families feel the most comfortable, pediatric offices are the main access point for kids at this age. This is where families are used to going to get their kids vaccinated. It's where the family and the kids feel most comfortable. So the pediatric clinic is the main access point for this age group. Beyond that, pharmacies will be able across the board to vaccinate kids 3 and up. And the pharmacies that have in-house clinicians namely the ones that have minute clinics or have, for example, a doc or a nurse practitioner on hand that actually provides some care. And that's some of the commercial pharmacies in town. They'll be able to go younger than the age of 3.
Thank you.
Great. We just have one more question coming up in the chat. So if anybody else has any questions that they still want to ask, make sure you get your organization name there. But we will go for the last one for now to Alexandria from KSLA in Shreveport.
Alexandria, you are on mute if you're asking a question right now.
Yes, sorry, I'm gonna pass for right now. Thank you.
Okay.
Hey, if there's not any other questions, as I mentioned before, we are going to be posting this briefing on YouTube. We can certainly field any of your questions over email this afternoon if you didn't feel like you got one in. Dr. Kanter, did you want to add anything else before we start closing up?
Sure. Kevin, thanks you and Michelle for helping run this and for all the communications assistance. Thank you, everyone on the call, for your continued coverage. COVID is not over, but we're certainly in a much, much, much better place than we were even a few months ago. And being able to extend vaccines to these younger kids puts us in an even further place. There are a lot of families across the state who are very eager to get their youngest kids vaccinated. And I count myself in that group as well. So this is very welcome news. We look forward to continued advancement here. We're eager to have every family take the opportunity to protect their kids as much as possible. Thank you so much for your time and for your coverage. And I hope you have a really good week.
Great. Thanks everybody for participating. We really appreciate it. Like I said, I put the YouTube channel in our chat. We can get the resources went out on the press release earlier today. We definitely encourage people to check our website and the vaccines.gov website, which should have information on where you can find providers. We'll be putting up a PDF this week of the providers where we're shipping, and vaccines.gov should reflect that shortly. So thanks everybody. Have a great day, and let us know if you need anything.